Minister,
apologies, Deputy.
Thank you, Councillor. Minister, at the outset I want to acknowledge that you are here today and to thank you for taking these questions. It would be very easy for you to walk away, but I thank you for being here and assisting with our queries. In relation to maternity leave, Minister, would you support the extension of maternity leave for mothers at this particular time? It is a matter that has been raised with me, and I know that there is a petition, very importantly, going around at present with almost 20,000 signatures on it. In relation to the opening of creches and childcare facilities, there is extremely little information or guidance being given as to how they are to reopen. Will numbers be reduced? Is social distancing really being suggested for children under 5 years of age? If they open with reduced capacity, will they get increased funding so that they can remain opening? These businesses understand that they will have to make changes, but they have not been given clear and proper guidance so that they can prepare themselves. It has also been talked about over and over again, but there is still nothing that has been put in place for frontline staff in relation to childcare. It is simply not good enough and cannot continue. And again, a lot of this is due to the lack of consultation with childcare facilities. Again, Minister, thank you for taking these questions, and I hope you will be able to give comprehensive answers.
Excuse me, thank you, Deputy. I'm so sorry. Just the first question again explicitly was in relation to women returning from maternity leave. Is that what?
In relation to maternity leave, would you support the extension of maternity leave for mothers at this particular time?
Is that the
can I explain?
Sure.
If a person is after having a child and their maternity leave is coming to an end, because of the fact that this happened during this pandemic, they weren't able to no. They weren't able to have the same interaction because of the pandemic with other outside agencies because of the pandemic. So would you allow for an extension of maternity because of what has gone on over the last number of months?
I think that sounds like a really good idea, Deputy. Okay. Your second set of questions had to do with the need for guidance in order for the reopening for the centres. I'm in complete agreement with that. I did, in my opening statement, I outline and identify the process whereby my department is developing that in consultation with the sector. And understand the need that particularly those guidelines based on public health advice, as well as opportunities for the sector itself to identify what are their questions into that public health advice, etc., that would need to be published. It would need to be developed and published prior to the opening, and that is actually what we are doing. Another point that you raised is in terms of the question around social distancing, and I did refer to in my opening remarks that for children, that social distancing is not a reality, is not a possibility, and that's my own personal view, but that's also been confirmed by the public health advice that we are getting. That's not to say that there aren't procedures and guidelines that both the adults as well as the children would need to engage in order to reduce the risk in terms of the transmission of the virus. But much of that the children would have been doing already in the context of the centres, because it's good hygiene and this is what they are taught, et cetera, et cetera. But the decisions around the numbers of adults to children, the space, et cetera, are currently being discussed, and we will identify what are the decisions in that regard and be placed in guidelines.
Childcare.
That
was the last question. You didn't address that. And that was with regard to nothing has been put in place for frontline staff in relation to childcare, and it is simply not good enough and cannot continue.
In terms of the reopening phase, that it's identified that certainly there will be a prioritization for essential workers. The other really helpful thing in terms of at that point of the phased reopening of society is that childminders, it is our recommendation, my department's recommendation, that childminders will be able to again mind children in the childminders' homes. My hope is that this is be something that will be accepted in the relatively near future by the department of the other departments and also the cabinet, that we can move forward in that regard, because we need to have that additional support and supply for the essential workers.
Minister, Deputy